Good day, everyone. Thank you for standing by. Welcome to the My Healthy Weight, a Solution for Medicaid to Address Obesity webinar. During the presentation, all participants will be in a listen-only mode. Should you wish to ask a question during the presentation, please use the chat feature located in the lower left-hand corner of your screen. As a reminder, this conference is being recorded. I would now like to turn the conference over to your host, Hannah Martin, at the Bipartisan Policy Center. Please go ahead.
Good afternoon, everyone, and thank you for joining us today for our webinar. My name is Hannah Martin. I'm a Senior Policy Analyst at the Bipartisan Policy Center, and I work with our Prevention Initiative. For those of you who are not familiar with BPC, we're a nonprofit bipartisan think tank based in Washington, D.C., and our topic areas include health, energy, immigration, education, the economy, and more. Joining me on the webinar today are Jenny Bogard and Deborah Mayer. Jenny leads My Healthy Weight for BPC and has worked with us for many years, first as the Director of Healthcare Strategies at the Alliance for a Healthier Generation, and now as a co-founder and managing partner of Commonality. And I'll let Jenny introduce Deborah a little later on. As was just mentioned, at the end of today's presentation, we will have ample time for Q&A, and we will be using the chat box feature on your screen. So please, at any time during the presentation, if you have any questions, go ahead and submit it then rather than waiting until the end to submit your question. And you won't be able to use the microphone, so the chat box is really the way to get a question in. And with that, I'd like to pass it off to Jenny to walk us through the My Healthy Weight initiative.
Great. Thanks, Hannah. Good morning or good afternoon, everyone, depending on where you are in the country. But I am thrilled today to talk to you about My Healthy Weight and give an opportunity for you to ask questions and learn more about this national movement. So My Healthy Weight is the first ever program where a collective group of payers have come together to address obesity treatment and prevention within their own member population. And we broadly define payers as insurance companies, Medicaid state plans, as well as self-insured employer groups. So our founding members, as you can see on this screen, come from a variety of different places and organizations. We span all across the country, including Alaska, and we have, employer groups that are nationally based. We have blue plans that are more geographically based. We have national insurers as well as Medicaid state plans. So I'm sure I don't need to talk to this group about why an initiative like this to address obesity prevention and treatment is needed. We know that there's upwards of, we spend $1.42 trillion a year on health-related costs attributed to obesity. But I really want to focus on the top 5 bullet points here. I've been doing obesity work for upwards of 15 years now and have worked with various medical associations and continue to do so today. I've worked with multiple different payers over the last several years. And really what we have found in all of the work that we have done is the lack of consistent coverage is a significant barrier for healthcare providers. And the easiest way to explain this is when you see a physician who has 30 patients a day in his or her clinic, that physician is essentially working with 30 different benefit design plans. So when you're thinking about implementing a preventive program, that physician doesn't know who has access to additional services. They don't know who has access to follow-up visits. So that, in essence, is a barrier, and we know from the literature that's been published is that the default behavior for physicians is that they won't do anything because they just don't know who has access to it. We also know that there is a lack of effective communication, both between physician and patient, as well as payers and members, as well as payers and providers and network. So how do we break down those barriers so we have a consistent way to communicate to everybody that is potentially touched with this obesity prevention initiative so that everybody knows who has access to what services are available, and what the eligibility is? We also know that when you typically implement a preventive program, when you don't broadly have blanket coverage, so if you're not offering it to your entire book of business, we know from the literature that there is an increase in denied claims. So we know internally there has to be consistent messaging with your own employees, within your own organization. And then finally, the lack of awareness. I mean, this goes with everything that I just said, but also the general lack of awareness for patients, for families, for individuals, for healthcare providers. We have to come together collectively if we want to efficiently and effectively address obesity prevention and treatment. So who qualifies as My Healthy Weight? What does this even mean? So when we worked with our task force, and I'll go over a little bit of how we got to where we are in a couple minutes, but when we worked with our task force members, some of whom are on this call today, we wanted to first align the obesity benefit coverage to the USPSTF recommendations. And for those who may not be familiar with that, that is a board of experts who come together, they review the existing literature out there, and they look at the evidence base that's been published. And from that, they make expert recommendations on what they feel could move the needle forward for a variety of different health topics. If you look at the USPSTF recommendations for obesity counseling and prevention, it does say that individuals, adults with a BMI of 30 or higher should have access to up to 12 visits a year. And we looked at the pediatric patients as well. So from one of the first required components of the pledge addresses these recommendations. We realized through the work that we were doing with our task force members that not every payer was completely compliant with this recommendation. So we needed to really meet the payers where they were.
Jenny?
Ladies and gentlemen, please stand by while we get Ms. Bogart back on the line.
Okay, can everybody hear me now?
Yes.
Okay, Hannah, where did you guys lose me? I have no idea how I got kicked off this call.
We did not hear the slide you are currently on the additional pledge components.
Great.
And the optional pledge components.
Great. Well, if anybody wasn't paying attention 5 minutes ago, I hope you are now. It's never a dull moment with virtual technology webinars. So as I was saying, we have these required components to the pledge that align with the USPSTF recommendations. And then we also heard loud and clear from our task force members that they really felt strongly that there had to be a community component piece to the pledge. And what this means is that the task force members acknowledge that there's so much that can be done in that initial exam visit, and that there's so much other additional support that can take place in that individual's community. So whether that individual and his or her family is going to the YMCA, whether they're going to other community organizations, payers really felt strongly that they wanted to continue that support throughout the course of that individual's journey to achieving optimal health. So we included that into the pledge, and an easy example of that would be the YMCA's DPP program, or Diabetes Prevention Program. We know that there's evidence base around that. We know that a lot of payers are now starting to cover that and reimburse for that. And again, our task force members felt very strongly that we had to have that community component to the pledge. And then we have some additional pledge components where we really wanted to encourage our payers to engage their members. Again, going back to all the research that we have found over the last 15 years of working with payers, we know that we have to also communicate. If you build it, that doesn't necessarily mean that they will come. So how do we continue to effectively communicate that, not only to your members, but as well as to your providers and networks so that they know that they're a part of this national movement. And then some optional pledge components are, offering nutritional counseling to everybody regardless of weight, as well as utilizing outcomes-based payments. These optional components, some payers are working to meet those right now, while others are still working on being compliant to the required components. So this is completely goes along with the pace of each individual My Healthy Weight member, and we're here to support them from a project support team perspective. So I really want to provide a little bit about how we got to where we are. I want to make this very clear is that we, myself, my team, Hannah at the BPC, et cetera, we did not create this pledge out of magic and out of our own opinions and perspectives. We launched a task force in October of 2016 where we invited payers from all across the board to attend an all-day in-person meeting. And we really went in with no agenda, and we wanted to hear from every single person in that meeting. What are the challenges? What are the opportunities? What do you think your organization can do to contribute to addressing obesity prevention? And from that, we synthesized over 20 pages of notes, and we did extensive and intensive follow-up with each individual task force member over the course of the next year. So whether that was virtual follow-up meetings, individual one-on-one calls, in-person meetings when possible, we continued this dialogue with each member because we wanted to ensure that we were reflecting back to them what we were hearing or what we thought we were hearing. And through these conversations and these meetings, this pledge was created, and it truly was a collective effort by all 25 plus members of this task force. From that pledge creation, we then launched the initiative November of last year. So it's been a year since we had a launch event in DC at the BPC office where we invited some of our founding members to talk on a panel about why they did this and why it was important for them. And from there, we've continued to support our My Healthy Weight members, and we're continuing to scale this and invite and recruit new organizations to join this movement. Part of the key benefits of joining the My Healthy Weight initiative is really it helps each individual organization meet their company goals and organization goals around obesity prevention and early treatment. It also really elevates your organization's commitment to addressing obesity prevention. But what we've also found is that this initiative has opened up so many doors for organizations to resources, networks, meetings that they didn't even know existed before they joined this initiative. So rather than looking at this as, oh, this is one more thing on my to-do list that I have to do now, this really was actually an opportunity for organizations to be given a key into this world of resources that are out there and available that our members didn't even know were there before they joined this initiative. So in addition to opening up this new world of network of organizations and individuals that are thinking about this and addressing this in multiple various different ways, we're also creating a repository site, which is a website where all of our My Healthy Weight members will be able to log on to and look at evidence-based programs that meet the required components of the pledge. So if you're an organization out there and you're thinking, how do I even begin to address this with my population? This website will allow you to look at evidence-based programs that have been published, that have the science, approved seal on it, if you will, that will be able to help your members, and you can potentially implement them from your organization's perspective. So that's just one additional resource that's at your hand when you join this initiative. Another resource that we're going to be able to send out in the next week or so is we've hired a marketing expert to really develop messaging so that our organizations, our My Healthy Weight members, can effectively communicate this to their healthcare providers as well as their members. So we've worked with this expert consultant on creating messaging that all of our members can utilize and insert into their existing communication materials. So whether that's brochures, whether that's on your website, whether that's through an email, we're providing the language that you can use to effectively communicate this initiative. But it's one thing for us to say it, and it's another thing for you to hear from your own peers. And through several meetings that we've had over the course of the last 6 months, we've heard loud and clear from associations and from other organizations that they really need to hear from peers in order to talk about this and understand what really is the value add. So from that, we decided to host these webinar series where we invited some of our My Healthy Way members. And I am thrilled today to be able to pass it over to Deborah Mayer to talk about South Carolina Medicaid and why they feel it's so critical that they join this national movement. And for those of you who are not familiar with South Carolina Medicaid, they are an extreme early adopter to obesity prevention and treatment in the state. And they really have been the gold example across all of our Medicaid state plans because they are fully committed at every level within their organization. So with that, I'm going to pass it over to Deborah to talk about South Carolina.
Thank you so much. Yes, my name is Deborah Mayer, and I am the Program Manager for the Division of Coverage and Benefit Design with the South Carolina Department of Health and Human Services, and we administer the South Carolina Medicaid program. Just to give you some background on where we are with obesity in our state, I'm going to show these two maps that show the obesity rate and utilization distribution for both children and adults within our Medicaid population. Regarding the overall rate of obesity in South Carolina, 1 in 3 children in our state are overweight or obese. This map specifically illustrates the rate of obesity versus utilization of our program based upon members who qualify. So as you will see, the darker the colors is the higher rates of obesity by county within our state. And then the blue circles are representing utilization by provider site. So it's no surprise seeing here that what are our larger, more densely populated metropolitan areas have more provider sites, and it's an urban versus rural comparison, and our lesser populated areas have very limited access to providers. Oh, another note, 90%, about 90%, a little more than that, of our children eligible for these services do actually participate in the program. So our utilization rate is high regarding children. Now moving to adults, 2 out of 3 adults in South Carolina are overweight or obese. We also have high incident rates regarding heart disease and stroke, tobacco use, and other things that certainly correlate to obesity in looking at the chronic disease picture. Again, with this map regarding the adult population for Medicaid members in our state, the higher the number, the darker the color, the higher incident rate. So you'll see it's not a pretty picture for our state regarding obesity. And also another issue we have is utilization of adults. As you will see here, our utilization of our program is dismal regarding adults who are eligible to receive these services. And I'll get into more that in a little bit. Just to kind of give you a timeline of where we have been regarding our nutritional counseling program and where we've started and where we are. Our coverage for obesity treatment for both adults and children was implemented in August of 2015. Really what was the impetus for this was our former governor was a very, very strong proponent of health and wellness, and it was her vision to do all she could to empower key stakeholders to improve the health status of South Carolinians. Our agency director at the time was on Governor Haley's staff previously, prior to coming to our agency. So I think it was a combination of her vision and her championing this, and having a professional relationship with our agency director was part of the pathway that led us to having coverage. And also on a state level, the South Carolina Obesity Action Plan had been developed in September 2014, and a group from a wide array of stakeholders committed to improving obesity was developed, called the Scale Down Initiative. And so that kind of led us to having that momentum and charge to have coverage. So that began in 2015. The program was rolled out. I was not present in this role or with the agency at that time, but I understand a very, very robust communication plan, face-to-face meetings, presentations occurred with an array of providers around the state. Then we fast forward to the November signing event that Jenny referenced, and then the next month we, within the agency, developed a preliminary decision packet to go to our executive leadership to evaluate our current policy and kind of identify the parts and pieces to that, and also delve into diabetes prevention. So it's to analyze and show what our current status was, and then also to identify and prioritize potential recommendations for enhancement of the policy based upon the commitment we made with signing the pledge. So that went to senior leadership for their review. And then in March of this calendar year, we received permission to move forward with a deeper dive to really come up with our comprehensive decision packet on what exactly we wanted to see the future of our policy to be. It would incorporate the components of the pledge and other things that we needed to do, whether it was an operational part or more of like medical, clinical. But we did receive that authority to move forward, which is what we're working on now. The other update was based upon us continuously having open lines of communication with the various providers, whether on the physician side, the dietitian side, office staff handling billing and coding. We received feedback on some simple tweaks to policy that would provide clarity in understanding and implementing our policy. So effective April 1 of this year, we just did a cleanup of existing policy just to make it easier to understand without any impact upon coverage or benefits. Moving on to kind of what our experience has been since we became a signatory of the pledge. Really for us, we were so fortunate that we had buy-in and support from our executive leadership. So it really wasn't a hard sell at all to have their commitment that we would sign the pledge. Really the greatest challenge from that timeline to present day was just coming up with the components of the initial policy. Obviously things can get very territorial and political, and really the most significant challenges we've had thus far was trying to come up with certain parameters and scope of the policy regarding what would be the allowed number of annual visits, not having a true sense of utilization of the program or cost implications. The physicians lobbied hard for requiring a physician referral prior to a member seeing a dietitian for counseling. Also, there was a decision of how would the distribution of visits be set. And just as a starting point with the initial policy in 2015, the decision was made to just have it as a 6 and 6 visit split between physicians and dietitians. Another important aspect of our experience to share is we never envisioned that signing this pledge would be such a springboard to other related efforts around chronic disease. And because of that component that Jenny referenced earlier regarding the community-based programs, which of course to us represents coverage for NDPP, we started moving down that path of evaluating coverage for NDPP, and we have since been invited to apply for a grant to participate in a pilot for trying to increase participation of Medicaid members in NDPP sites around South Carolina, which is the most fantastic timing for this opportunity because it will just enhance and leverage our discussion for coverage for NDPP. Another part of the lessons learned discussion is how incredibly crucial partnerships are. They're such a symbiotic situation. We have worked so closely with a variety of groups, and I never could have imagined the collaborative spirit and support and help that is gained through this. We meet regularly, at a minimum quarterly, if not more, with the South Carolina Academy of Nutrition and Dietetics. We work with the South Carolina Medical Association, the South Carolina chapter of the American Academy of Pediatrics, and we partner very, very closely with our state health department, which is the Department of Health and Environmental Control. Through our work as a pledge signatory, we were connected with the Stop Obesity Alliance, and I have sat in on fantastic meetings in D.C. as part of a roundtable discussion surrounding development of standards of care for obesity treatment in adults. And I previously mentioned the Scale Down Initiative, which is a South Carolina state-level group of key stakeholder organizations working towards obesity coverage and treatment. As I mentioned earlier, input from stakeholders is so incredibly important, whether it's just getting feedback on shortcomings of the policy from an operational standpoint. And our intent is when we move forward and have an actual draft policy, we are going to solicit help through advocacy groups and organizations and a variety of folks to make sure what we're putting out there makes sense medically, clinically, operationally. Another important facet of our experience is it is so important to get out there and engage publicly with these groups and professional organizations, whether it's attending their meetings, accepting opportunities to present. I have only been with this program for 1 year. I came online to work with our obesity policy just about the time the pledge was signed. And every time I speak at some of these events, folks come up to me that tell me, I had no idea that you covered this, and I would love to be an enrolled provider. So that public engagement is really important. And also, as I mentioned, buy-in from senior leadership, which we are thankful that that was not a challenge for us. It's just been in place now for 3 agency directors, and we're just fortunate in that, but that really is a key factor. As Jenny referenced earlier, the main takeaway for me is kind of ignorance is bliss, and I was obviously new to this arena, and I just had no idea what was available in all forms of resources, whether it's counterparts at other agencies, other professionals in the field. I had no idea what resources were out there and available that have just been incredibly helpful. And people are so kind in this industry to open doors and make connections and help you. And I had an opportunity to connect with someone via a colleague in the obesity treatment world that has helped me with our move towards coverage for NDPP. So there's so many resources out there, and getting connected with the pledge just continues you down a path with a lot of different organizations, and it's on a national level, and you can exchange ideas. So that has been incredibly helpful. And one thing not mentioned on here, but for us, going back to the data I shared on utilization of our program, it's apparent when we have a 1% utilization of our program with our adult members that we need to get the word out again, even though I understand it was covered thoroughly 3 years ago. So that is a key, very key and very incredibly helpful benefit of becoming a signatory is having communications experts that will customize a communications plan for us, whether it's messaging in a presentation or brochures or some type of written document. But we have had a meeting with the group to discuss plans for our communications, and that's incredibly helpful to have professionals who can guide us down that path. Just to give you a quick overview, so these are some of the things that we are looking at regarding enhancing our current policy. We presently do cover adults with a BMI of 30 or greater, or children who are in the 95th percentile or greater in weight. So obviously we're looking at expanding our members who are eligible. We're looking at increasing the frequency of allowed visits per year, which is currently at 12. Presently, all visits are limited to 2 15-minute units for a total of 30-minute visit. We're looking at expanding that because we need more time for initial visits. We would like to remove the visitation split between physicians and dietitians with the 6 and 6, and also remove the requirement for a physician referral. Presently, we use 2 different coding sets for adults and children, and we would like to utilize one universal set. We've received feedback that that is troublesome and problematic for providers to be juggling different sets. Presently, we have an exclusion criteria in place for pregnant women and those on medications resulting in weight gain. One barrier to provider access, we know, revolves around our dietitian rate. So our actuaries are evaluating that presently to enable us to increase our dietitian rate to incentivize dietitians to become enrolled providers in our network. And as mentioned previously, we are evaluating coverage for NDPP, which is kind of running on a concurrent path as the obesity side. But because of needing to get a state plan amendment and enroll a new provider type, it's just going to be a longer process than moving through the obesity side. And I think that's all I have.
Great. Thank you so much, Deborah. Just a reminder for everyone, if you have any questions for any of the speakers, please use the chat box in the bottom of your screen, and we will get to those. The first question I want to ask for Jenny is, so South Carolina was one of our, or is one of our shining stars, and had one of the easier processes to getting approval for sign-on for My Healthy Weight. But I was hoping you could speak to some of the resources and talking points, etc., that you provided to other My Healthy Weight signatories, especially other state Medicaid agencies, when their staff was trying to get that initial approval with leadership to sign on to My Healthy Weight in the first place?
Yeah, I don't think it was necessarily a talking point or points, Hannah, but it was more of providing that additional support. So we know that, the task force members were just one individual in a large organization. And what we were trying to do and what we successfully did is try to be that support system for that individual. So they then went back to their organization and they talked about this task force and eventually the pledge and, how could we be that additional support? So whether it was virtual calls with additional members of that organization, whether it was sending them information, an overview, a one-pager, et cetera, we were happy to do that. But it really was highly dependent upon each organization. And I think that's one of the beauties about having our product support team is that we can customize that support so that it fits that organization. So we're happy to be in person, again, have a webinar. I've done presentations via webinars to organizations and having their entire staff there or the appropriate individuals from each organization be part of that webinar and that meeting so that they can ask questions and I can address any potential concerns. But really that's highly dependent upon that organization.
Great, thank you. Reminder, please put in your questions if you have any. Jenny, could you just go over what, if anyone is interested in, maybe they are not like a state themselves, but they're a provider or they're in some other position where they're affiliated with their state Medicaid agency, but maybe not part of it or in a position of power, what they can do to try to advocate for My Healthy Weight in their state?
Yeah, I think everybody has a responsibility and an opportunity to talk about the My Healthy Weight initiative. Whether you are an individual healthcare provider working independent, you do work with payers in your state or in your community. So any connections you have, mentioning this to them, we have a one-pager that we can share with you, connecting them to myself and doing that warm handoff so I can continue to have those conversations with that payer. If you were part of a healthcare system, so you're a provider, part of a larger organization, ensuring that your organization is walking the talk. So are they offering this themselves as an organization? Are they reimbursing for their employees to have access to these services? There's a lot of things that we can all be doing to continue to elevate this initiative as well as continue the dialogue of how to effectively address obesity within your own states. You can also, similar to what South Carolina did, is be part of a coalition if there's something going on, or even start it. It could be just a handful of like-minded individuals in your community that really want to have a honest and candid conversation on how to address obesity. So there's multiple different ways. I know it seems a little overwhelming sometimes as we sit here in our desks and have multiple different competing priorities of how do you kind of start a movement like this one. But you can do it, and it could be just as simple as having that conversation with somebody at a payer, having a conversation internally at your organization, connecting somebody to myself or anybody on my team. Those are really important critical steps for us to really continue to scale this program and continue to invite and have new organizations join us. So it really is a group effort. I can't do this alone. Hannah can't do it. We really are leaning on everybody from multiple different organizations to come together and really elevate this program.
May I jump in a second? This is Deborah.
Please.
Sure.
I was just going to mention, if you have any questions about our experience as a signatory or our Scale Down initiative, which is the statewide effort, or anything like that, please feel free to contact me. has been mentioned several times, and with Jenny, it takes a village to do this. And the one thing I have found is those in the obesity world are just so quick to offer help and make connections and be a resource. And we just really want to stress that it does take a village. And if there's anything I have mentioned or referenced, please feel free to contact me to either discuss the role as a signatory or anything else that's going on in our state or anything about our policy.
Great. We have a question or a couple questions for Deborah. The first is, you mentioned that a lot of this got started because you had strong support from a previous governor, previous administration. What has been your experience getting a new governor, and have things just continued on as usual, or did you have to resell this to a new administration?
It's really been business as usual. We have, I think the situation we had in 2014 and 15, really was significant to get this off the ground, but there hasn't been any lag, even though we are now on a new governor and on Agency Director 3 since the initiative rolled out. So we haven't, it's continued on as usual. I mean, there's so much going on in our state through scale down, and then, somewhat related is there's a diabetes advisory council that meets on diabetes. And of course, there's a lot of crossover with participants with scale down and the diabetes advisory council between physicians and dietitians or diabetes educators, a lot of folks covering both areas. So fortunately, there's been a great platform developed, and it's just continuing to move on business as usual, even with leadership changes.
And another question for you, Deborah, was how did you initially choose to provide 12 nutrition counseling sessions when you first implemented that? And since then, have you all conducted any outcomes-based analyses around the individuals who've taken advantage of those 12 sessions?
This recently came up in my scale down meeting about any data, and we have not yet evaluated the health outcomes over a period of time with this, but that's something I want to delve into to explore that and look at things. So we've not done that yet. And I presume that the 12 visits were selected based upon what other states were doing or some type of standards of care. I was not present when this occurred, but I'm sure we often look at what other similar states are doing, or either it was based on some type of standard somewhere, but we obviously know that we would like to expand the number of visits. I can get a more specific answer to that, but that's just my perceived take on where the 12 came from.
Great, and I can connect you to that individual later. The same person had another part to their question that I'm actually going to answer. So there's a little confusion about when Jenny was mentioning the evidence base of 5% or more weight loss in adults, and I just want to clarify that meeting that requirement is something that the community-based programs that are being covered have to do. So if you are looking at just the first part of the pledge and these clinic-based visits with licensed healthcare providers, healthcare professionals, et cetera, and you're looking at the 8 visits or the 12 visits, that is separate from the community-based program like a DPP or similar program. And those more community-based programs that may be using different provider types, community health workers, et cetera, those are the programs where we're asking our signatories to make sure that whatever they're implementing or buying into has that 5% weight loss evidence base. And I got a great question. Someone's clairvoyant. Will an archive of this presentation be available? Yes. We will get a recording back after this, and we will post it to our website. I will also be emailing it out to everyone who attended today and also everyone who registered but was unable to attend. So it'll be a video basically as if you had watched this webinar live with the slides, and it'll have an overlay of the speakers. So I will give it another minute or so if there are any last questions. We've gotten some great ones thus far. While we're waiting to see if there's any final questions, Deborah or Jenny, are there any closing remarks either of you want to provide?
I'll be happy to mention it. I just wanted to say that if any of you are concerned about this commitment with this pledge increasing a very heavy workload, please don't feel that it is problematic. It really helps streamline and focus your efforts, and I think it just organizes your efforts and what you're doing to be more efficient and targeted, especially when you're not searching high and low for resources, whether it is organizations or colleagues or people or documents or data. I just think it has been such a benefit to us to have a go-to who are experts in the field surrounding policy. And I just can't say enough about the experience we've had in the past year becoming a signatory, and I highly encourage it, and feel free to contact me with questions.
And I'll just echo. Sorry, Hannah.
Sorry, go ahead, Jenny. I did get.
Okay. I'll just echo what Deborah just said, is, this is not an additional to-do list. We need to be addressing this anyway. This is an opportunity for you to effectively communicate it internally as well as externally. And one of our My Healthy Way members said it best is, if you're looking at, well, what's the cost of this, for us to join or, to offer this, and there is no cost to sign the pledge. You can sign it, if you want, but what's the cost of not doing anything? And that's really the question that we need to be asking ourselves when we're looking at obesity prevention, early treatment, is that the numbers don't lie, the data doesn't lie. Healthcare costs continue to increase that can be attributed to obesity-related issues. We've got to get ahead of this, or else we're all going to be in trouble. So I would ask you to, if you go back to organizations, is to ask them, well, what's the cost of not doing this? And this is an opportunity to join other organizations to address this and try to get ahead of the issue. And our big audacious goal from a project support team perspective is we want everybody across the country and every insurance benefit plan to have access to critical services to address this. And I think we can do that. We just have to work together and continue moving forward.
And one final question for South Carolina for you, Deborah, is around what you're planning to do for your managed care organizations, and is this going to require changing their contracts, and how are you going to ensure that individuals under managed care will have access to these benefits?
The preliminary proposal that we developed that was shared with our leadership in December, we did include a snapshot of what our MCOs are covering. Minimally, they must cover what we cover, and then what they do beyond that is open to each individual MCO. We have a great relationship and regular meetings with our MCO medical directors and quality directors. And so I know that when we come up with what we feel like is a pretty robust draft for our policy revision, obviously that will be part of it, is to work with them. But ultimately what they cover above and beyond our benefits is up to them, and they don't necessarily all offer the same coverage. But we are also participants in the CDC 618 initiative that one of the health conditions addressed is diabetes prevention, and we're about to send out a survey to evaluate what each of the MCOs is doing with health conditions tied to that initiative. So we're constantly in contact with them to evaluate what they're covering, what they may not cover now but intend to cover. So we're just trying to keep the lines of communication open with them, and absolutely they will be part of this discussion when we get to the point where we're ready to actually share a proposal with them.
Great. So it sounds like at a minimum they're going to be covering at least My Healthy Weight. And so all of those talking points around the 8 visits and the 12 visits will still apply, and some people may even have more.
Exactly.
So I don't see any final questions. So I just want to thank everyone who submitted them. Thank everyone for joining today. Thank you again to Jenny and Deborah for presenting. Again, the slides will be on the BBC website, and I'll be emailing them out as well, probably sometime next week. If you'd like any more information, please visit myhealthyweight.org. And I hope everyone has a fantastic afternoon.
Thank you, everyone.
And this concludes today's call. Thank you for your participation. You may now disconnect.